When I compare it to the equipment I use in my own office, it's amazing how this portable device, so small, has actually progressed so quickly. I'm Dr. Mohammed Bardi. I'm a practicing rheumatologist in Vancouver, British Columbia. I'm part of the Faculty of Medicine at UBC, and I'm a part of the Division of Rheumatology. Like any rheumatologist, I see patients for all sort of rheumatic conditions, rheumatoid arthritis to lupus to vasculitis. I use ultrasound in all of my assessments. So in my room, my ultrasound machine is essentially like my stethoscope. So everyone I see, whether I'm scanning joints or looking at glands or looking at blood vessels, it's part of my daily assessment. And what's kind of unique about my practice that I really enjoy is I share patients with many rheumatologists in the province. They send me patients to assess for inflammatory arthritis or other conditions that we use ultrasound to evaluate. I think it's such an exciting time in rheumatology. In the early 2000s, rheumatology went through this kind of golden age where we have all these new therapeutics, new medications. We can treat patients and give them better outcomes. And I think what's really been changing in the last 10, 15 years is how ultrasound's playing a role in our diagnostics. To be able to do point of care testing, to have someone in front of you can examine, you can talk to, and then you can have another tool to confirm your suspicions, it's so valuable. So from a diagnostic clarification perspective, ultrasound has really come out in terms of assessment of inflammatory arthritis, vasculitis, some of our conditions like lupus that have lots of different organ manifestations. We're getting more and more insight of how to use in those conditions. And also we can use ultrasound for assessing response to treatment. Like if I see somebody has inflammatory arthritis, I can start treatment with them, and then I can bring them back 3 months later and after I've given them a drug and see what's changed. When I have patients who I can show them their old images and their new images and they can see the difference, it really helps, one, with patient adherence, but also you get to educate your patients, they're more well informed. Even within this year, as I've had different touch points with the Clarius, different technologies that have been rolled out, like voice commands, which really helps the workflow and the integration. And I saw some of the AI features where it was highlighting the tendon today as I was scanning with the probe. Like that blew my mind, and to see that that's happening so quickly and that there's that kind of nimbleness to the technology is fascinating. I think the portability is really valuable. My practice can be so varied. Like I could start one day in my office, I could do a clinic when I go to the Pender Clinic at the downtown east side, and then I'm in the hospital after that. So to be able to have something that goes with me, I can't take my cart-based machine everywhere I go. I do travel clinics to northern BC. So to have something I could take with me and still have that power to do that clinical assessment and to not lose that is super valuable. I do lots of procedures in rheumatology, like any peripheral joint I inject, or if I need to aspirate a joint. It's really valuable to be able to get a video loop to kind of record the procedure, make sure the needle's in the right place, and have that for documentation purposes. To be able to have voice control during that time, it just frees up your hand, it just helps with the workflow. What I am seeing now on the B-mode imaging, it's getting quite comparable. And when you consider the cost and prices, like 10 to 20 times different, it's impressive that it can do that. When I first picked up the probes, rheumatology for inflammatory assessments like synovitis, tenosynovitis, I just didn't think it had the Doppler capacity at all. Whereas now I'm starting to see that that's actually getting better. And it's something I'm looking forward to seeing over the iterations that come, like how those improvements keep going. And it's something that I could see that in a patient who has moderate inflammatory disease, it could reliably pick it up. I also think that the L20 probe, for instance, like that really has such a high resolution for superficial structures that I don't think there's anything that's portable that really compares to that I've seen. Being able to look at nerves, so if you follow a nerve, you get pretty good detail with that, and that's pretty exciting.